Hello everyone and welcome to Edusurg Clinics. I am Dr. Gunjan Desai. I am a GI and HPB surgeon at Lilavati Hospital, Mumbai. And we are going to discuss some very commonly asked questions about gallbladder cancer. So we will see what the gallbladder does for the body. It's very commonly asked because most of the surgeries entail removal of the gallbladder. And so it is commonly asked that how the lifestyle will change once the gallbladder is removed. So we will start from the basics and then go towards the risk factors of gallbladder cancer, the different signs and symptoms that you can notice at your home. Because as you all know, prevention is the key in most diseases, especially non-communicable diseases like cancer. So let us see all these points, and towards the end, we will look at how you can reach early and diagnose it early in case the disease happens in you, unfortunately, and also some measures by which you can attempt to prevent gallbladder cancer. So let us see where gallbladder and biliary tree are located. So in the human body diagram, this is where the biliary tree starts, okay, the small green structure. If I zoom it for you in a common digestive system diagram that we see, this is the gallbladder, the green structure below the liver that you can see. If we want to simplify this diagram, the green structure shown here is the gallbladder, the bigger organ is the liver, as you all know, and the gallbladder secretes its contents into the bile duct. So that is what you need to understand. So basically, the first point that needs to be cleared is that it is the liver that produces bile and not the gallbladder. The gallbladder is just a storage organ. So when we are not eating, the ampulla or the opening of the bile duct, which is the region where the bile duct and pancreatic duct meet, is closed. Okay. And this is when the bile that is produced by liver is just stored in the gallbladder. Okay. So gallbladder is a storage organ as far as bile is concerned. So then what does the gallbladder do in our body and why is it an important organ? Well, it stores bile which is produced in liver, and whenever we eat and whenever the digestive hormones produce a stimulus, it is the gallbladder that secretes the bile which helps in fat digestion. Also, the quantity produced in liver is quite huge, whereas the volume of gallbladder is not more than 50 to 60 ml. So what gallbladder does is it absorbs the water and mucus from the bile and concentrates bile. So basically, the gallbladder stores the bile, concentrates the bile, and secretes it when the call for it comes from the intestinal enzymes and hormones. However, when we remove the gallbladder, the bile which is produced in liver directly enters the intestine. So essentially the digestive system remains the same, and that is why there are no major changes in your diet and lifestyle after gallbladder removal. So now coming to risk factors for gallbladder cancer, the most common question asked with patients in gallstones is it a risk factor for gallbladder cancer? Gallstone by itself as a definition does not cause gallbladder cancer, but because of gallstones, what happens is that the gallbladders can become chronically inflamed, and an inflamed system always breeds cancer. So that is why when you are symptomatic for gallstones, it is always recommended to remove the gallstones. And for asymptomatic patients, it depends on case to case basis. I already have a video on when to remove the gallbladder. You can have a look at it. But understand that if you have gallstones, it is important that you meet a surgeon and a gastrophysician and make sure that you are not symptomatic. Obesity and physical inactivity are also risk factors for gallbladder cancer. Smoking is a risk factor. Some pre-existing diseases, a condition known as porcelain gallbladder is 10% chance of having cancers in future. So porcelain gallbladder is a risk factor. A very commonly seen scenario is a patient presenting with gallbladder polyps in an asymptomatic setting on a health checkup. What to do? Well, it's a big topic, but in essence, a polyp more than 1 centimeter is always a risk factor, and it's better to get it removed. For size less than 1 centimeter, there are multiple options, so we can discuss that in a separate video. Choledochal cyst is a bile duct disease, and choledochal cyst by itself is a predisposing risk factor for gallbladder cancer. So these are some of the pre-existing diseases. Primary sclerosing cholangitis is again a bile duct disease. So choledochal cysts and primary sclerosing cholangitis are two bile duct diseases where there is inflammation of the bile duct, and these are also risk factors for gallbladder as well as bile duct cancer. So these are some of the risk factors that you see. Now, non-modifiable risk factors are basically gender and age. Females are more likely and age is more than 50. These are non-modifiable risk factors, but there are risk factors like smoking, obesity. If you know there are gallstones, you can get it out. Polyps, you can get it out. Porcelain gallbladder, you can get it operated. Choledochal cyst and primary sclerosing cholangitis have treatment options. So that is how you can modify your risk for gallbladder cancer. How to suspect gallbladder disease? There are some very classical symptoms, and sometimes you have symptoms that are not very characteristic. The most common symptom is central upper abdominal pain or right upper abdominal pain, which goes to right upper back or central upper back. If there is unplanned weight loss, it's a very classical red flag for cancer and tumors, also seen in diabetes. So don't think that it is only cancer, but unplanned weight loss should lead you to your doctor. Loss of appetite and early satiety are again two risk factors that should lead you to your doctor. Very important. Right upper abdominal mass. If you touch your abdomen and you feel something there inside the abdomen, then it's a sign that there may be gallbladder disease. Fever is a feature of gallbladder disease. Jaundice, that is yellow skin, eyes, and urine or clay colored stools and itching are common signs of bile duct blockage. Jaundice can be seen due to liver dysfunction, bile duct blockage, as well as cholecystitis or stones in the bile duct. So, important point is that if you have jaundice, pain, and fever, it is highly likely that you have gallstones, which are now complicated. So, reach your doctor fast. Nausea can be present, vomiting can be present, which is more commonly post meals. Blood may or may not be present. But the important point is that if you see any of these symptoms, meet your doctor immediately. So, if you are aware of the symptoms and signs of gallbladder disease, the prevention begins with awareness. How you can change your risk or how you can reduce the modifiable risk factors that are present in you. There are some points. Avoid processed meat, avoid high fat containing food or reduce the proportion of it in your diet and increase fresh fruits and vegetable. In lifestyle, weight control is important. Quitting alcohol and smoking is the goal, but an achievable target is at least to reduce it significantly. Exercise and weight control to control obesity is very important. For all gallbladder diseases that are modifiable risk factors that we have seen already, such as gallbladder polyps, especially more than 1 centimeter, and similar such diseases, the advice is to get the gallbladder out. Okay. For choledochal cysts, you may have to remove the bile duct as well as the gallbladder. So these are some of the prevention strategies for gallbladder cancer. Important point is that identify the issues early. If you have symptoms, meet your doctor immediately. All patients with risk and symptoms, it's important to be aware. Educate your neighbors, educate your family, have a regular follow-up with doctor. If you have risk factors for cancer, then you should enroll in a screening program with your doctor. It may need a CT or an MRI. It may need tumor markers such as CA and CA19-9. And surgery can also be a preventive tool in these scenarios. Thank you.